Yeah.
Okay, hey, my name is Eric Baumgartner. I'm a licensed acupuncturist and working here at Urban Remedy Community Acupuncture. It's kind of a new kind of center that's happening here in Venice in West LA, and we're based on a model that's coming out of Portland, and it's a model of all access healthcare. We're really working on how to get global access to natural medicine, preventative care such as acupuncture. And the way we're doing that here is by offering group style treatments. We have 8 recliners where people can kind of come in on a rolling scheduling basis. Makes it really easy and flexible for your schedule and your lifestyle. People come in and basically they get treated here in this group setting, and we sort of take advantage of the comfort of the space and the energy of the group that happens when you have more than one person kind of engaging their healing process. You all seem to benefit from what's happening in the group. That enables us to bring the cost of treatment down to between $25 and $50. We offer treatment on a sliding scale. And we really encourage people to come in for regular treatment. Getting treated more than once in a week, especially if you have something that is acute or something that has been bothering you for a long time. It's really important to get regular treatment in the beginning. And in fact, in China, where the medicine comes from, that's how they treat. They often will give you a prescription for 10 treatments over the course of 2 weeks. And then when you come back, then they'll reevaluate. Most of the time, you don't need to continue treatment after that, or you may go back to a kind of a maintenance schedule in terms of your treatment. But they have found, and we have found, that that by doing frequent and regular treatments, that the results that you get are dramatically better. This model of healthcare is really a kind of a grassroots revolution that we're really trying to promote in the healthcare industry, and especially the natural healthcare industry. What has happened, many people know, and everybody's talking about what's happening in healthcare right now, and we have a really unique opportunity at this time in history to really reevaluate and to make progress and to make change. It's really what people have been asking for. One of the challenges with that is that, as you know, making change may take time, and we really feel that what we're offering right now, here in the present moment, is a solution to the healthcare conundrum that we've created for ourselves. We have accessible healthcare that's affordable for everyone, and it works on a preventative level, it works on a sort of a rescue level, and it really solves and addresses the problem of getting people access to the care that they need. We really want to remove the dollar sign from the equation of whether or not you take care of yourself, whether or not you do what you need to do to stay healthy. If you're constantly worrying about how much it costs to take care of yourself and actually putting that in the department of luxury in terms of your budget, well, I think we all know how that works for us. It gets you into crisis mode, and then you're asking to be rescued by antibiotics, or some sort of an emergency procedure, or some kind of an extreme some kind of an extreme situation where you're down for 4 or 5 days with a cold. We really feel that this is a positive solution to what's happening in healthcare right now. It's available and it's affordable, and it's easy. A lot of people are afraid of acupuncture needles, so I am constantly surprised by, and most of my patients who've never had acupuncture before are surprised that they don't even notice when the needles go in. It is a big question, and a lot of us do have fear around needles, but really these needles are nothing like needles that you've seen before. They're not hypodermic needles. They're not, they're actually called painless insertion needles, and they're single use. We only use them once. We throw them away. So if that's what's keeping you back from being healthy, I hope that you'll reconsider. So we treat everything under the sun. in terms of medicine. And obviously our specialty is not emergency medicine. That's really the domain of your medical doctor. If there's something major that you're coming in for, that's not us. But we are primary healthcare practitioners and in the state of California, and so we are able to treat just about everything. This healthcare system was designed for total health. We treat everything from shoulder pain to colds and flus to gastric and digestive disorders to diabetes and chronic autoimmune conditions. These are all things that can benefit from acupuncture. The sort of common denominator, I would say, is that people need to find some kind of way to take care of themselves. And we live in a society where there are a billion stress factors that many of them we don't even notice. And we want to really talk about what's the main cause of disease. It's probably stress. Acupuncture treats stress better than anything I've ever seen. I think it's even more effective sometimes than some of the more relaxing techniques like massage and other sort of modalities that really focus on getting you just relaxed. Acupuncture is very focused, and it is able to treat your specific condition. We take into consideration your whole sort of health picture. We're able to treat very specifically for where your imbalance is and how that stress, whatever the stress be, whether it's an environmental factor, whether it's your job, whether it's your relationship, whether it's just kind of a life change that you're going through, all those things, we can actually treat them. They are causes of disease in our sort of understanding of medicine. We're not just talking about the germs and the little microbes and the molecules of pollution that are affecting you. We're talking about how your lifestyle is not working, and we can actually affect your ability to change your lifestyle with acupuncture. And your ability to manage the stress that you do encounter, because everyone has stress. It's not a matter of totally eliminating stress. It's a matter of how to make your body able to adapt to and able to respond, in a positive way to the stress factors that you do have. And obviously sometimes we got to eliminate some of the stress factors, the unnecessary ones. So yes, we do treat all kinds of different conditions, and like I said, I think one of the best things that happens here is that people find that their ability to cope with stress and their ability to release the stress that they find in a day is greatly enhanced. They come in here and have a few needles in and almost inevitably take a nap, really deep, restful, and restorative 15 to 20 to sometimes 45-minute nap here in one of these comfortable chairs, and walk out feeling totally renewed. Part of this model also really puts the responsibility for your own health back onto the patient. We really strongly feel that part of what's happening with this healthcare revolution is that people are taking the responsibility for their own health back into their hands. Rather than feeling like they're totally dependent on their physician or on another practitioner to tell them what to do, we really are about empowering people as to how to take on your own health and how to really engage the process of regaining your health. So, that's part of the philosophy behind having a kind of a minimalist interaction with the acupuncturist while you're here. We do take your pulse, we do read your tongue, we do take into consideration new symptoms that come up. We use that information in our treatment. But largely, this is your time to sort of take in what's happened for you over the week in between treatments, or to kind of allow the needles to help your body to do its own balancing. And that's really how acupuncture works. It's about giving the body the information that it needs to do what it does naturally, to come into balance naturally.